What is up, guys? Sorry for the extremely late posting of this video. Saturday was a really rough day for me, and actually I'm still awake. It's been a lot of pain and just kind of lethargic-ish, and so yeah, I just been not doing much. I did play a little bit today, so that felt good, but beyond that, didn't do much, so that's why this is coming at you really late, so I apologize for that. But today, in lieu of yesterday's video, and my obviously recent doctor's visit on Thursday, I'm going to talk about the prostate, as possibly that's probably what's happening with me. That's what my doctor thinks most is going on, not scar tissue or other stuff. So we're gonna touch on that a bit and kind of what's been going on down there and how it's been going on the Flomax. It's been 3 days, I think I've been on it. I don't know. So okay. What is, for those of you that don't know what the prostate is, not that I'm an expert in it. It's just what you can research. But apparently it's something in between, like a sac or something that's in between your bladder and your tubing, that where your urethra, I guess that's what it's clinically called. And so I guess when the prostate enlarges or swells or inflames, whatever it does, that's what causes the pain and the difficulty of peeing, because it's squeezing on the tubes. So that's why I'm taking Flomax right now. I saw my urologist on Thursday. I believe it was Thursday. And yeah, going over just my symptoms, which at first it was just a minor pinching sensation when I was emptying my bladder. And then over the last year, it's significantly increased in pain and frequency. It was only like every once in a while. Now it's every time I went pee, there was that sharp pinching, stabbing type sensation. And then on top of that, what occurred was I was having a hard time actually just starting to go, pee. And I might have said it on a video last week or something, but essentially, yeah, it feels like everyone's trying to rush out a door, like you see in those stupid comedy, silly slapstick type movies, where two people try to walk through the door at the same time, they get stuck. It's kind of like that. Just obviously way more force and way more pressure and pain and everything. And sometimes it could, a few seconds of me kind of just trying to wait it out or push it out will happen. But it's, 5-10 seconds at least that I usually have to do that on average, and it's every time I go. So it's pain and pressure trying to go, and then it's just pain exiting or emptying, I should say. The other thing on emptying is sometimes it actually doesn't fully empty. That's a newer one for me, actually. Usually I didn't have a problem with that, but within the last, month or so, there's times where like it trickles, and so I kind of have to push. Like it's kind of like I have to push and then it kind of stops, and then I stop pushing, and then I start again. And I don't have to do that. It's not like it's a lot that's left in there. But last thing I want to do is have to take another quick early trip to the bathroom because I didn't feel like just fully emptying it. I don't know. But that's not a big deal. It's mostly the pain and such I've been having. Now, obviously, most men don't deal with prostate problems until they're older. But, which I'm glad my doctor also said this, that it doesn't mean that it can't happen in younger men too. It just is more common in older men, but younger men can get it early. So that's what he feels is going on in there. Otherwise, like I said yesterday, he's gonna have to down my urethra, aka my penis. So yeah, I hope there's no other keys. But yeah, so I've been on Flomax for I think 3 days now. At least 3 days. I know that much. And I will say today, after the third dose, I do notice an improvement. There on emptying my bladder, that pinching pain is gone mostly, and on startup, there's not that blockade pressure thing, but there is still this, I don't know how to explain it, but there's just this like lulling of just some sort of sharp pain that is just there through the process. It's different than the other pains and symptoms I've been dealing with, so I'm not sure what that's about. I don't know if that's just the medicine not fully in effect, or it's only working somewhat. I don't know if there's higher doses for that medicine or stronger medicine. I don't know. But I do notice an improvement. The problem is, though, my doctor said that it's either it completely alleviates your problem or we scope you. So it's 100% or bust. And right now it's probably about 85. Now, granted, I've only been on it for 3 days, so I'm okay so far with an 85% improvement. But they haven't called me yet with the appointment, but they said it's like 6 weeks out. So I have 5 weeks to test this drug and or other drugs to see if it helps 100%. Otherwise, the unpleasant option comes in play. Dun dun dun. I will say I'm not a fan of Flomax. I mean, I deal with a lot of the symptoms that it has. So I'll just run over the common ones real quick. Dizziness, check. I deal with that a lot. But the dizziness that this has been giving me is so different. I literally was shopping Friday, and 10-20 minutes in, I was so sick to my stomach, so nauseous, so dizzy. I didn't know if I was gonna need to sit down and vomit or what, or it was unpleasant. And actually nausea is also one of the side effects. And I dealt with nausea, and I deal with nausea, I should say, but not all the time. But this, it kind of reminded me of that nauseated feeling I have, excuse me, when I've been having that intestinal pain, that really bad pain. So I'm like, I don't want to experience that either. Lightheadedness, which kind of goes hand in hand with dizziness in a little bit, in my opinion. Weakness, drowsiness, diarrhea, back pain. Well, unless it new, I probably won't notice a difference because that's one of my main pain problems. Blurred vision, already have that. Dental problems, already have that. Sleep problems, already have that. Runny or stuffy nose, yeah, I already deal with that. Sore throat or cough, yeah, I already deal with that. So, but I do know that my doctor said that, most patients become dizzy, or lightheadedness and so forth. Like it's almost, he said it almost like it's a certainty that it's going to happen, which actually it did. But he says if it doesn't go away after like 2 days max, then you're technically supposed to stop taking it. So let's see, I started it Thursday, and then I did it Friday. And Friday is when I went shopping, and that's when it was like really bad. I mean, Thursday night it was pretty bad too, because obviously it was my first time on it, and so my body was like not adjusting yet to the new medication. But Saturday, or today, technically, well, not technically today, but today for me, like I said, I've just been kind of out of it, and so I've just been kind of relaxing and resting. Not really doing much physical, so I don't really know. I mean, I don't know if it's just when I'm doing things more physical, or just up and about, or just in general. I don't know, but I didn't really experience that too much. But I did also, I will say, because on Friday I usually don't eat breakfast. Occasionally I will, but often I skip it, and I don't eat till lunchtime, which when I started shopping it was like maybe an hour before lunch, maybe sooner. And I thought, well, maybe I just have to eat something in the morning. It was just a little something. So this Saturday morning I ate something. So maybe that's why, I don't know. But I'm just gonna give it till Monday. If it still seems like it's there, I'll tell them, hey, the side effects aren't going away. Let's try something else, because I have adverse effects to medications, and my body likes to suck in terms of medication. It's either, oh, hey, here's a new medicine, let's adapt to it and be good, well, which doesn't always happen. More likely it's, oh, new medicine, let's get used to it after 2 days. Now it doesn't work anymore. You gotta up it, and then rinse and repeat. That one sucks. The other one is where, let's say one of the side effects is, what's a good one to go with? Let's just do migraines. So let's say one of the bonus side effects of the drug is helps prevent migraines. Well, instead it actually causes it. I've actually had that happen on the old happy pill, I guess, whatever, depression pill, way back when. So yeah, like I said, I'll wait till Monday. I'll try to be a little more up and about on Sunday and see if I can cause that to happen, and I'll skip breakfast too. If it's something as stupid simple as eating breakfast, I mean, I don't really want to, but hey, if it means the medicine will work and it dials back the symptoms, then so be it, but yeah, I would prefer not to, obviously. But yeah, I'll like I said, I'll play with it one more day, and if I still feel like it's there, I'll just tell them, let's try something else. So, sometimes I get lucky, like I did with the amlodipine. The first day I kind of felt that extra dizzy, off balanceness stuff, and then my body right adjusted to it, and I was good. And all the side effects were stuff I already dealt with on a daily, so it wasn't a big deal. And it wasn't like adding more to it. It was just, yeah. So yeah, I mean, we'll just see what happens. Obviously, I would, like I said many times, I prefer not to get scoped. But if that's the case, then hey, that's the case, right? But what I didn't know, because I've never cared to look up prostate, because why would I, right? I mean, that's how most people are. You don't look it up until you have it, or you think you have it. But apparently there's several different types of prostate, like at least 4 I'm seeing on a couple of sites. I don't know what all the different causes are. I didn't really go too much into detail in terms of research. But I do know that either way it's unpleasant. Despite the fact that they may have to scope me, I'm just more nervous of, one, if it is scar tissue in there and it's not thin enough, as he said, to just kind of normally break off when the scope goes through the urethra. If it's too thick, then they have to surgically go in and remove it, which, again, that's major surgery. It's nothing like the heart surgery I might have had, but surgery is surgery, and every surgery is a huge risk to me, especially with all the added health problems I've been dealing with, the blood pressure, the heart regurgitation, I mean, obviously I'm not some skinny model. But yeah, it's just a risk, and I would prefer not to do it. I mean, I think if it came down to where he said it was needed to fix that, I think I would probably ask him what would be the downside to not doing it, other than obviously the symptoms I'm already dealing with, because while they're painful and annoying, it's honestly not that bad compared to the normal crap I deal with on a daily basis. And so if it meant just putting up with the pain and that's it, or risk major surgery, I'd probably have to weigh that with my current doctors and just kind of, see what they all say. But I just don't know if it'd be worth the risk. Plus then I'd be put out for, I don't know how long or how limited that would make me. And I heal, I take twice as long to heal as most people, so yeah. I just don't look forward to that. Plus I also just worry that they'll go in there and poke around in the bladder and stuff and find something worse, and heaven knows I don't need that right now. So here's hoping that medication works. Not that I want to be on another freaking medication either, but you gotta pick your poison, right? And that's exactly what this is. I have to pick what flavor of poison I want to suck down for the rest of my freaking life, basically. So fun times. It's always something new, right? The saying, you learn something new every day. Well, mine should be you get something new every day. Man. But yeah, it is what it is, This is kind of my life now. Just gotta deal with it, roll the punches, sort of thing. But yeah, obviously as things develop or whatnot, I'll keep you guys apprised of what happens and how well or not well the medication is working. I will say the amlodipine, which is the blood pressure medicine, is keeping my blood pressure at least steady. Before it kind of fluctuated. It was more in the upper end of normal to sometimes high to sometimes kind of low or in the really good range. And it would kind of fluctuate, so it's good that it's now at least more stable. So at least that's a good thing. I'm happy about that. And like I said, the side effects are totally fine on that, and so that is good. So yeah, with that, I'm gonna call it here, guys. Again, I apologize for the late video, but I appreciate all of you. Love you guys, and I'll keep you guys up to date, and I'll see you next time.